There's something really unsettling about looking fine on the outside while something dangerous is quietly brewing inside you. That's what high blood pressure does. It hides, it waits, and too often it strikes without any warning. Many seniors think they're doing everything right. You take your pills, you go to your checkups, maybe you walk a bit, eat a little healthier. But what if I told you it's not the obvious things that are putting your heart at risk? It's the small habits, the quiet mistakes, the things no one talks about because they seem harmless. Yet over time, they tighten your blood vessels, wear down your heart, and silently rob you of your energy, your sleep, and your peace of mind. Today, I'm going to guide you through 8 critical blood pressure mistakes that most people over 60 make without even realizing it. This isn't about blame, it's about awareness. Because once you understand these mistakes, you can gently shift them. You don't need a new prescription or a strict diet, just a few mindful choices that can truly change how your body feels. And the final mistake in this video is the most surprising of all. It has nothing to do with food or medicine, yet it might be the missing link to why your numbers stay high no matter what you try. So stay with me till the end. You might see yourself or someone you care about in this. If any part of this video resonates with you, please leave a comment below. I'd love to hear your thoughts. And don't forget to like and subscribe to Health 365, your daily guide to living stronger, longer, and with more ease after 60. Now let's ease into the first hidden mistake. One that sounds simple but has powerful consequences if left unchecked. It might seem like a small mistake one, missing a pill here and there or taking it a little later than usual. But for your heart, those small slips can create real chaos. Blood pressure medication isn't like a painkiller where you feel the relief right away. It works silently behind the scenes, keeping your arteries relaxed, your heart steady, and your risk of stroke or heart attack much lower. That's why being consistent is super important, more than most folks realize. But here's the deal. A lot of seniors don't take their meds exactly as they're supposed to. Sometimes they just forget. Other times they feel fine and think, maybe I don't need this anymore. And then there are those who try to save a few bucks by cutting pills in half or only taking them every other day. While these choices might seem harmless at the time, they can really mess with your blood pressure. One day it's all good, and the next it's dangerously high, and you might not even notice it. That kind of roller coaster ride puts a lot of stress on your heart, kidneys, and brain every single time. Plus, stopping your meds just because your numbers look good is one of the most common and risky mistakes. Often, those good numbers are thanks to the medication doing its job, not a sign that you're suddenly cured. So, what can you do? First, make taking your medication a habit, not a daily dilemma. Use a pill box with the days labeled. Set a gentle alarm on your phone. Pair it with something you do every day, like brushing your teeth or having breakfast. And if you ever have side effects or if money is tight, don't just stop taking the meds quietly. Talk to your doctor. There are usually alternatives, lower doses, or discount programs available. Because here's the bottom line. Your medication only works if it's in your body doing its job, and your heart is counting on you to help it out. Now that we've covered the basics, let's talk about something sneaky that's hiding in plain sight right on your plate. You might think, I hardly use the salt shaker anymore. I'm being careful. But here's the surprising part. Over 70% of the sodium most people consume doesn't come from the salt you add. It's already packed into the foods you buy, and that's where the trap lies. Blood pressure goes up when your body retains too much sodium. It causes extra fluid to linger in your bloodstream, which pushes harder against your artery walls. Over time, that constant pressure can harm your heart and may silently lead to strokes, kidney problems, or heart failure without you even noticing. While you might avoid chips and salted peanuts, sodium can sneak into places you wouldn't think of, like canned soup, deli meats, salad dressings, sauces, and even seemingly healthy choices like whole grain bread or frozen veggies with sauce. Many of these products are packed with salt, not for taste, but to extend their shelf life. Here's the kicker. As we age, our kidneys become less effective at removing sodium from our bodies. So, even a small amount can lead to a bigger spike in blood pressure than it would have in the past. That swelling in your ankles and the puffiness you notice in the morning, sodium could be a contributing factor. But don't stress. This isn't about sacrificing flavor or joy in your meals. It's about being a bit more mindful. When you shop, take a moment to check the labels. Look for terms like low sodium or no salt added. Rinse canned vegetables or beans to get rid of extra salt. Try cooking at home when possible, as this gives you control over what you include. If your food seems bland without salt at first, that's totally normal. Your taste buds will adapt, and soon you'll rediscover the true flavors of your meals. Garlic, lemon, herbs, vinegar, these can enhance taste without putting extra strain on your heart. Every small choice counts, and each bite can be a quiet act of safeguarding your heart, brain, and future. Now that you understand how hidden salt impacts your body, let's shift to something just as subtle but even more perilous if overlooked. One of the most dangerous aspects of high blood pressure is its silence. You might feel perfectly fine, go about your day, laugh with friends, take a stroll, and still have dangerously high numbers ticking away inside you without any indication. That's why it's crucial to regularly check your blood pressure at the doctor's office isn't the whole story. It's like trying to judge an entire movie from just one frame. Your blood pressure can change all the time based on what you eat, how well you slept, your stress levels, and even the time of day. For a lot of people, readings at the clinic can be too high because of nerves or too low if they're feeling calm. If you don't check your blood pressure regularly at home, you're missing out on the bigger picture. You might overlook subtle signs that something is shifting, like a medication not working as well or a new food habit causing your numbers to rise. Plus, you could miss spotting dangerous spikes before they escalate into something serious. But here's the bright side. Keeping track of your blood pressure at home doesn't have to be a hassle. Most home monitors these days are affordable, user-friendly, and come with big buttons and easy-to-read screens. Just make it a part of your daily routine. Choose a time like first thing in the morning or early evening. Sit quietly for 5 minutes, rest your arm on a table, keep your feet flat, and avoid talking. Then take your reading and jot it down in a little notebook or use a simple app. That log becomes your story, your body's report card, and it's super helpful for your doctor. If you're feeling anxious about high readings, you're not alone. But remember, knowledge is power. Ignoring a problem won't make it disappear. In fact, catching it early can often mean the difference between needing a minor adjustment or facing a serious health issue. So, think of your blood pressure as a daily check-in, not something to dread, but something to comprehend. Your numbers are trying to communicate something to you. Let them speak, and you'll know exactly how to react with clarity instead of guesswork. Now that we've uncovered this hidden danger, let's shift our focus to another one that lurks deep within your daily routine. It all begins with your stress. Stress. Mistake 4 doesn't always show itself in dramatic ways. Sometimes it's not about yelling or crying, it can be silent. It's that tight feeling in your chest when bills start piling up, the worry when your body aches, the heaviness when you miss someone you care about. It's quiet but impactful, and when it sticks around, it really puts a lot of pressure on your heart. You see, when you're stressed, your body thinks it's in danger. It releases hormones like cortisol and adrenaline, triggering your fight or flight response. These hormones make your heart race and your blood vessels constrict. That's helpful in short bursts. But when stress becomes an everyday thing instead of a rare occurrence, your blood pressure stays high. Over time, that constant tension can wear down your cardiovascular system, whether you realize it or not. Many seniors were taught to be tough, to push through discomfort without complaining. But bottling up emotions, hiding pain, or constantly worrying in silence doesn't make you strong. It just makes you exhausted. And sadly, it causes your blood pressure to creep up. The good news is, managing stress doesn't mean you have to completely change your life. It means finding little moments of peace in your day. Just 5 minutes of deep breathing, slowly in through the nose, slowly out through the mouth, can help calm your nervous system. A quick stroll in the garden, some gentle stretching, or sitting by the window with your favorite music. All of these signals to your body say you're safe. You can relax now, even chatting with someone you trust, sharing a worry out loud can lighten the load on your chest. Journaling, praying, or just sitting in silence with a warm drink can give your mind a chance to rest. Don't wait for stress to blow up. Take care of it every day, like brushing your teeth, because stress might not show on your skin, but it always leaves a mark on your heart unless you ease its grip. And once you start creating these moments of calm, you'll notice something else. Your body begins to respond, not just in your blood pressure, but in your sleep, your energy, even your digestion. Speaking of movement inside the body, there's another mistake that often hides under the label of rest, but too much of it can quietly chip away at your strength. There's a common belief, mistake 5, that as we age, we're supposed to slow down. And while rest is important, the truth is that sitting too much too often is one of the quietest ways we put stress on our hearts. When you don't move your body regularly, your heart starts to lose strength. It has to work harder just to keep blood flowing through your vessels. Muscles weaken, circulation slows, and blood pressure gradually creeps upward. And you may not feel it right away. You might just feel a little more tired, a little less steady on your feet, a little less you. But here's the hope. Movement doesn't need to be intense to be powerful. You don't need a gym membership or fancy sneakers. You just need to move consistently, gently, in a way that fits your body. A short walk around the house, standing up during TV commercials to stretch your legs, marching in place while brushing your teeth, rolling your shoulders, or flexing your ankles while you sit in a chair. These small acts of motion help your blood flow, lift your mood, and gently lower your pressure. Physical activity also helps you sleep better, think clearer, and feel more capable. It gives you the sense that you're still in charge of your body, not the other way around. Of course, it's normal to worry. Maybe you've got joint pain, feel unsteady, or fear falling. That's okay. Start where you are. A doctor or physical therapist can help you find safe, pain-free ways to move. And once you find something you actually enjoy, whether it's dancing to old music, planting flowers, or stretching with the morning sun, it won't feel like exercise. It'll feel like living. Movement reminds your heart that it's still needed. It keeps your blood vessels flexible, your balance sharp, and your confidence strong. So instead of thinking, I should rest more, ask, how can I move just a little today? Now that we've woken up the body, let's check out 2 everyday comforts that seem harmless, but can quietly mess with your blood pressure if you're not careful. A warm cup. Mistake 6 of coffee in the morning, a glass of wine with dinner. These little habits bring comfort, especially after 60. But when it comes to blood pressure, even simple pleasures can have hidden effects, especially if we're not mindful of how they impact our bodies. Let's start with caffeine. It's a stimulant, which means it speeds things up. Your heartbeat, your alertness, and yes, your blood pressure. For some folks, this spike is minor, but for others, especially those already facing hypertension, even 1 cup of coffee or strong tea can send blood pressure into risky territory. The tricky part, you might not feel anything at all, just a bit of tension in your chest or a racing pulse that's easy to ignore. Caffeine isn't just in coffee, it's also found in energy drinks, sodas, chocolate, and even some pain relievers. And as we age, our bodies process caffeine more slowly, meaning it lingers in the system longer and can impact sleep, heart rhythm, and stress levels. Alcohol tells a different tale. It seems to relax you, and in small doses it might. But over time, regular drinking raises blood pressure, messes with medications, and leads to poor sleep, weight gain, and dehydration. Plus, since aging slows the liver's ability to handle alcohol, even small amounts can hit harder than they used to. Combine alcohol with blood pressure meds, and the risks increase, causing dizziness, confusion, and strain on your organs. 1 glass might be fine, but 3 could push your system over the edge. But this isn't about sacrificing your favorite comforts. It's about being aware. Try this. Check your blood pressure before and after your morning coffee or evening drink for a few days. If you spot a trend with higher numbers, restlessness, or headaches, it might be a good idea to cut back or look for alternatives. There are heart-friendly swaps that still feel comforting. Chamomile tea, warm lemon water, flavored sparkling water with a slice of fruit. They soothe, hydrate, and protect your health without raising your pressure. The goal isn't about restriction, it's about intention, making choices that don't take away joy but help your body enjoy life longer. And while these small habits accumulate, there's still one more piece that ties it all together: your connection with the person guiding your health journey. Your doctor isn't just someone who prescribes pills, they're your teammate in this journey. But even the best doctors can't help with what they don't know. One of the biggest mistakes many seniors make, often without realizing it, is staying quiet. It's easy to do. Maybe you don't want to come off as complaining. Maybe you feel rushed during appointments. Maybe you've been taught not to bother anyone unless it's serious. But here's the truth: everything you're experiencing matters. A small side effect, a missed dose, a new supplement, a change in your mood, these aren't minor issues. They're clues. And if you don't share them, your doctor is only working with half the puzzle. High blood pressure isn't a set it and forget it condition. It fluctuates with stress, diet, sleep, medications, and even the weather. That's why open, ongoing communication is so crucial. Let's say your blood pressure numbers look fine at the clinic, but at home you're seeing spikes. Your doctor needs that information, or maybe you stopped taking a pill because it made you feel off, but you didn't mention it. That could lead to uncontrolled blood pressure or a preventable emergency. And don't forget about your emotional health. Loneliness, grief, anxiety, these don't just weigh on your heart emotionally, they influence your blood pressure physically. Letting your doctor know how you truly feel gives them an opportunity to support your overall health, not just the numbers. You don't have to have all the perfect words, just speak from the heart. Jot things down before your appointment so you don't forget. Bring your blood pressure log. Ask questions, even if they seem silly. And if getting to the clinic is difficult, inquire about virtual appointments. Many doctors now provide video visits that are just as effective. Your doctor isn't there to judge you, they're there to walk with you. The more honest you are, the better they can assist you. And when both of you are aligned, your treatment evolves from just a prescription into a plan that suits your real life. Now that we've discussed the significance of connection and communication, let's wrap up with a mistake that lurks in the quietest hours of the day, but can impact your blood pressure all night long. Sleep isn't just mistake 8 rest, it's healing. It's the time when your heart rate slows, your blood pressure naturally decreases, and your body resets from the day's stress. However, when sleep becomes disrupted, shallow, or too short, your heart never gets the break it requires. Many seniors face challenges with sleep. You find yourself lying in bed awake at 2 a.m., tossing and turning, watching the clock, or you fall asleep easily but wake up too early, mind racing, body fatigued. Sometimes you think it's just part of aging, but the reality is that poor sleep isn't just annoying. It subtly contributes to high blood pressure. When your body fails to enter deep, restorative sleep, stress hormones like cortisol stay elevated. Your blood vessels remain constricted. Your heart continues to work harder than it should. Over time, this takes a real toll, not only on your blood pressure, but also on your memory, mood, energy, and immune system. And if you snore loudly or gasp for air at night, it could be sleep apnea, a condition where breathing can briefly stop during sleep. It's more common after the age of 60 and often goes unnoticed. If left untreated, it can significantly contribute to resistant high blood pressure. So, what can you do? Start by adjusting your sleep routine. Dim the lights an hour before bedtime. Turn off screens. Avoid heavy meals, caffeine, or alcohol in the evening. Try reading, listening to soft music, or taking a warm bath to help you relax. Keep your bedroom cool, quiet, and dark. Go to bed and wake up at the same time every day, even on weekends. If you find yourself still awake after 20 minutes, don't stay in bed feeling frustrated. Get up, stretch, breathe, and then try again. If sleep continues to elude you, or if your partner notices loud snoring or pauses in your breathing, consult your doctor. Sleep studies can now be conducted at home, and treatments for apnea, like a simple CPAP device, can greatly enhance both your sleep quality and blood pressure. Here's the reality. Your heart takes a break when you do. Quality sleep not only helps you feel better, but also makes you more clear-headed, energized, and shields you from the silent harm of high blood pressure. Now that we've identified this crucial mistake, let's wrap it all up with some guidance for moving forward. You've just made a significant step, not just by watching this video, but by giving yourself the gift of awareness. Managing high blood pressure after 60 doesn't mean living in fear or sacrificing the small pleasures that enrich life. It's about understanding how your body communicates and gently modifying your habits so they respond with strength, balance, and calm. You don't have to overhaul everything overnight. Perfection isn't necessary,